My name is Samir Mardini. I'm a plastic surgeon at Mayo Clinic, and today I want to talk to you a little bit about facial paralysis and facial reanimation. One of the things that, one of the real strengths of Mayo Clinic is the team approach, and we have organized a very nice team to treat patients with this kind of problem. So when you first come in, you see the surgeon, and we'll have a nice discussion about what you have. We'll diagnose the problem. We'll try to look into the different reasons why you have this and try to dive into what prognosis is. So if we think that this might get better on its own, or if there are exercises that we can do to get you better without surgery, of course we'll talk about that. We'll take some pictures, get some videos. This helps us sort of follow the progress that you're having, and if we do some kind of surgery, then we have things to compare the after surgery to the before surgery. And then we send you to our physical therapist. We have physical therapists that's heavily involved with our patients, and what she does is she looks at you and tries to figure out how much movement you have, and if she can work on improving what you have already, and to see if that can get you to where you want to be. There are tools that she uses, like exercises, a muscle stimulator or nerve stimulator. These things, what she'll do is she'll work on you while she's with you, and then she'll send you home with some sort of homework to do at home, basically. But and then after the surgery, if we end up doing some kind of surgery, of course the physical therapist will help us optimize the results of the surgery. We then will look at different specialists that we have organized for this our team to see which ones would be appropriate for you to see. So we have the ENT specialists, they're ear, nose, and throat surgeons, they're head and neck surgeons. They are experts in diseases of the face and facial nerve, and particularly when the facial nerve is involved closer to the skull, and when we have to go deeper into the skull. Some of our patients, they end up having issues with their speech and their swallowing, and we have a therapist that will work with them on that before and after surgery if there's surgery involved. We then have our ophthalmology team, and the ophthalmologist that sees you, because the eye sometimes is involved, the ophthalmologist will assess your eye. They'll kind of look at it and see if there's anything that's wrong with it, and then if there's something that can be done to protect the eye, then they'll be the people that are involved in that, and often they're involved in surgery and doing procedures that can help us protect the eye. We also have a neurologist, and the neurologist, because their specialty is the nerves, and obviously when you have this kind of problem, nerves are affected. We often ask them to get involved in kind of looking at the future, and to see if we think that the nerve, or if they think that the nerve can recover on its own, or how long we need to wait before we start diving into surgical procedures and things of that sort. So once we've had you see the appropriate specialist, then the surgeon will meet with you again. And at that point, we look at the overall picture. We look at all the recommendation from the different specialists that you've seen, and we formulate a plan. And when I say that, I'm talking about formulating a plan that works best for you.